I want to thank everyone for waiting. Senator Boxer is on her way. We had votes, as you know, so we appreciate everyone's patience. I know that Senator Boxer will be joining us, and I know that Senator Nelson of Florida is also. We're very honored to have him here with us. I am the chair of the Subcommittee on Children's Health, and as the mother of a 14-year-old, I'm particularly interested in doing all that we can to protect and improve the health of our kids, especially when it comes to the environment. Every one of us has a stake in making sure our kids grow up happy and healthy. This is important not only for the well-being of our kids, but also for our country. I know parents have an increasingly difficult job in today's world, the economic pressures, the time demands, the many outside influences that affect our kids. All of these and more make it an especially challenging time for America's families. Since I've entered the Senate, I have made children's health one of my top priorities. Part of that is because I got involved when a little kid, 4-year-old, swallowed a charm that he got with a pair of tennis shoes, and he ended up dying. He didn't die from choking. He didn't die from somehow that charm blocking his airways. He died because there was lead in that charm. When they tested it, it was 100% lead, and the lead in that charm went into his bloodstream, and he died over a period of days. And when you hear stories like that, you know that things are not all right for the kids in this country, and that's why I worked with Senator Pryor and others and Senator Nelson on the Commerce Committee to pass what the Wall Street Journal called the most sweeping consumer legislation in 16 years with the Children's Products Bill that we passed. I've also worked with Senator Crapo on our formaldehyde bill. We now have many, many authors, I think nearly 20 authors, and it's heading to the floor. It went through the committee. Again, formaldehyde and wood products, something that's not a partisan issue. We're also looking at the effects of outdoor pollutants. With nearly 9 million kids in the United States affected by asthma, it is the leading serious chronic illness among our children. Outdoor air pollution worsens existing asthma. Kids are already at greater risk from outdoor air pollution than healthy adults, since kids have smaller airways than adults, which are blocked easier, causing children to breathe more rapidly. According to the EPA, 66% of kids live in countries that exceed allowable levels of at least one of the principal air pollutants that cause or aggravate asthma. That not only affects our children's health, but it contributes to $3.2 billion in medical costs per year, and that was actually 66% of kids live in counties that exceed allowable rates. We're also working in the Agriculture Committee to increase nutrition standards. That bill is actually being introduced today by Senator Lincoln, and something that will also be important as we go ahead for our children. But more work must be done. I joined with Senator Boxer in requesting the GAO report that we will be hearing about today, because we wanted to learn more about what EPA is doing to focus efforts on children's environmental health. With the increased prevalence of asthma, obesity, chemical toxins, the agency should be focused on what steps we can take to prevent the spread and incidence of these risks, but also researching long-term strategies to help improve the overall health of our children. To develop an effective, focused strategy, EPA must be working with other agencies, like the Department of Health and Human Services, to coordinate this effort. At one time, we had this coordination. In 1997, the President's Task Force on Children's Environmental Health and Safety Risks was authorized by the executive order to provide us guidance and interagency coordination on children's environmental health. This task force ensured that agencies were working together on efforts to improve health and provided the type of commitment we need to ensure long-term goals to combat environmental risks. That's why I'm proud to introduce legislation along with Senator Boxer that would finally reestablish this task force. As a former prosecutor, I know that the first responsibility of government is to protect our citizens, so we must do everything we can to make sure our government is doing all that it can to protect our youngest citizens from environmental harm. Ensuring that agencies are coordinating their efforts not only means that we can develop an effective strategy to improve the health of our kids, but it means that our government can ensure we're using taxpayer dollars effectively and not duplicating programs or working at cross purposes. I look forward to hearing from our panelists about the GAO's findings and efforts to address the environmental health issues that are affecting our children. They are the most vulnerable among us, and it is our responsibility to protect them. our first witness, or more than that, expert testifying today. I'm pleased to see Senator Nelson here, and he has been very active on this issue. I know that because I'm on the Commerce Committee, and I thank him for coming today. Senator Nelson.
Thank you, Madam Chair. Madam Chair, may I just talk to you and submit my comments for the record, along with a number of letters from the people in the area affected?
Without objection, your comments will be put in the record.
Madam Chairman, we have an area west of West Palm Beach in Palm Beach County, Florida, called the Acreage. It is a residential area that has a rural character. There have been a number of children diagnosed with cancerous tumors, and all live within a radius of a couple of miles of each other. Naturally, the consternation of not knowing if this is a cancer cluster has disrupted the lives of thousands of people who live in this area, because now, with the fact that it might be a cancer cluster, you know what's happened to the values of homes, and you know what's happened to the ability to sell your home if someone has to move. With the fact that some people who are so fearful that this is a cancer cluster have moved out and are renting elsewhere in the city, in the county, while still maintaining the mortgage of their home in this particular area. This is an upscale area. It is on well water, and in this part of Florida, these are shallow wells, and they are on septic tanks. And so the question is, what is the cause? So a year ago, when this came to my attention, I went to the Florida Department of Health. A part of them is the county health department. They are the appropriate ones to get in and try to determine if this is a health hazard. And for almost a year now, they have been studying this, and they can't come up with any conclusions. And so I am asking this committee, and thank the good Lord that you've got a committee that is concerned that there might be these cancer clusters around the country. I'm asking this committee to bring the full weight of the expertise of the federal government to assist the first responders, which are the state departments of health, in determining if these are cancer clusters, and if so, what we can do about it. And that means reaching out to the expertise of the EPA, the Environmental Protection Agency, as well as the Department of HHS, and all of its myriad of agencies, including the CDC, the NCI, the NIH, etc. Now, that's what we need, because these people are in a terrible situation, fearful for their health, but at the same time, because of no conclusions, paying a terrible price in not being able to move on with their lives. In the testimony that I have submitted and some of the letters I've submitted, I have chronicled the specific cases of children that had these brain tumors. Now, is this something from the soil? Is it something from the shallow wells of the water? Is it particularly because children are ones that get in the dirt and crawl around on the floor? and play in the puddles? We don't know. And we need to help bring about a resolution of information and conclusions. Thank you, Madam Chair.
Thank you very much, Senator Nelson. We really appreciate it, and hopefully we can get to the bottom of this. Senator Cardin.
Well, Senator Klobuchar, Chairman Klobuchar, thank you very much for conducting this hearing on the Government Accountability's Office investigation of EPA's effort to protect children's health. Let me use a little bit of my time in opening statement to introduce a witness that will be on our second panel, Dr. Cynthia Baer. We welcome you to the committee from the University of Maryland Medical Center in Baltimore City. She is the Kobe Professor of Neonatology and Chief of the University of Maryland's Medical Center Hospital for Children's Division of Neonatology. Dr. Baer is here today on behalf of the Children's Environmental Health Network, for which she serves as the board chairman. The network is the national organization whose mission it is to protect children from environmental health hazards and to work to build a healthier environment for kids to grow in. And we certainly welcome you here, and we look forward to your testimony. I apologize. I'll be running in and out because of other duties today, but thank you for appearing before our committee. And let me just point out generally, Madam Chair, if I might, the importance of this subject. We know that children are more vulnerable to the environmental risk. We know that their bodies cannot detoxify at the same efficiency as older bodies can. We also know, as Senator Nelson pointed out, children are closer to the ground. Therefore, they're crawling around and are more vulnerable to the environmental risk factors. We also know that they eat and breathe more per body weight than adults do. So in 1993, the National Academy of Science came to the conclusion that children are not little adults and therefore are more vulnerable to these environmental risks. I was pleased in 1997 that the EPA established the Office of Children's Health, as well as the Advisory Committee to implement and oversee a national plan to protect our children from environmental exposures. A major undertaking of the EPA is the participation in the National Children's Study authorized by Congress in 2000. The National Children's Study examines the effects of environmental influences on the health of 100,000 children across the United States, following them from before birth to age 21. Health disparities are also affected by environmental factors, with environmental health risks affecting minority and low-income children disproportionately because of the demographic trends in the United States, according to the Interagency Forum of Child and Family Statistics. To this end, it's particularly important to conduct research on children that will include racial and ethnic minorities. There was one finding, Madam Chair, that I know provoked, I think, this hearing, and that is EPA has not updated its national agenda regarding protecting children's health in over 10 years, and that the recent 2009 goals do not include the Office of Children's Health as a target area for improvement. This hearing is very important. Our children are our most precious assets. We say it over and over again. We want to do everything we can to protect them. They do not have the same advocacy as the adult community has. And yet, as Senator Nelson pointed out in a specific example, they are extremely vulnerable to environmental risk. The Environmental Protection Agency must have a focus on what we can do to protect our children from these environmental risks. The study is an important part that they're participating with other agencies. It's also important that we update the strategies on a regular basis, and I think this hearing is an appropriate oversight for our committee, and I thank the chair for conducting it. And with that, I would yield back the balance of my time.
Thank you very much, Senator Carter. Senator Lautenberg.
Thanks, Madam Chairman, for having this hearing. Each of us who has a grandchild is immediately an expert on children's health, and the concerns that we have for them rise to the tops of our agenda. And I'm fortunate enough to have 4 kids and grandfather of 11 between my wife and I, and the subject is a crucial one for us. I see in my own family, I have a grandson, 16, who's got asthma and a granddaughter who's 11 who has diabetes. And we, in order to help them, I'm determined, and I know that we all are, to make sure that we do everything for grandchildren across our country. And that's why in 1997, President Clinton issued an executive order to protect infants and children from environmental health risks, and the administrator of the EPA created the Office of Children's Health. That office developed into a powerful force that consistently fought for the well-being of our nation's children, made sure children's health was a top priority in EPA research, budget, and policies. The office also made sure that children's health was a primary factor when the agency created cancer guidelines, environmental toxin guidelines, and its database on chemical risks. Unfortunately, the progress made to safeguard children's health ground to a halt during the Bush administration, as today's report from the Government Accountability Office makes clear. The EPA seemed to develop collective amnesia, lost focus on children's health issues, and the Office of Children's Health withered on the vine. In fact, the administrator of the EPA office showed such little interest in the office that it went without a permanent director for 6 years. And as today's GAO report concludes, the Office of Children's Health, here I quote, declined in the absence of direct and meaningful support from the EPA's administrator. The good news is that things have turned around with Administrator Lisa Jackson at the helm of EPA. She's recommitted to the agency to protecting children from environmental dangers, moved quickly to appoint Peter Gravatt, we welcome here, the new director of the Office of Children's Health, and made him a key advisor on her team. Soon after his appointment, Director Gravatt issued a roadmap with 5 clear priorities to protect children's health, and I was pleased that he made the reform of the Toxic Substance Control Act, known as TSCA, a top priority. Right now, TSCA is not up to the task of protecting our kids from toxic chemicals. It's got to be overhauled so we can figure out what chemicals children are exposed to and what exactly we need to do to protect them. Children, as was said, are not simply small adults. They're extremely vulnerable to the acute dangers of toxic chemicals. And according to a report by the Healthy Families Coalition, as much as 5% of cancers, 10% of neurobehavioral disorders, and 30% of asthma cases in children are associated with toxic chemicals. And I don't know whether a report, the op-ed piece by Nicholas Kristof, written in the New York Times, where he raised the question of toxic and autism. And it got a lot of attention, and we're going to be focused in that area, thank goodness. So we're here today because more work has to be done when it comes to children's health. Unfortunately, I too am called to other places. But Madam Chairman, is an important committee and important hearing, and I'm sure that we'll establish a good record from which we can work. Thank you very much. Thank you, the witnesses.
Thank you very much, Senator. Now we are going to move to our first panel, and if you could come forward, and I will introduce you. You okay? Oh, I've got to move up. There we go. Okay, well, thank you for being here today. We have 2 panelists for our first panel. The first is Dr. Peter Gravatt, who is the Director of the Office of Children's Health Protection with the EPA, and the second is John Stevenson, who is the Director of Natural Resources and Environment with the Government Accountability Office, or as we know them, the GAO. So we will start with Director Gravatt.
Good morning, Madam Chairman and members of the committee. My name is Peter Gravatt, and I am the Director of the Office of Children's Health Protection and Environmental Education at the U.S. Environmental Protection Agency. Thank you for the opportunity to appear before this committee to discuss EPA's efforts to improve children's health. Children face greater threats from environmental pollutants than adults due to differences in their physiology, activity patterns, and development, and not all children are the same. We continue to see disparities in exposures and health outcomes among the poor, African American, Latino, Native American, and other ethnic minorities. Children's health is a driving force behind Administrator Jackson's priorities. In February, in a memo to EPA senior managers, she reaffirmed EPA's commitment to considering the health of pregnant women, infants, and children in all human health related activities, and to the use of EPA's policy on evaluating health risks to children and the best available research and data to guide our children's health protection efforts. In the memo, Administrator Jackson describes EPA's children's health agenda and identifies my office, the Office of Children's Health Protection, as having the lead in ensuring that the agency is successful in its efforts to protect children's health. EPA agrees that the GAO report reflects the progress of the agency's children's health protection efforts, accurately portrays the agency's challenges in addressing children's environmental health, and sets forth sound recommendations on steps that could be taken to better incorporate protection of children's health as an integral part of EPA's everyday business. EPA is implementing a comprehensive strategy to ensure protection of children's environmental health, which embodies the 5 key priorities I've previously discussed for children's environmental health at EPA. EPA will use the best science to ensure that regulations provide for protection of children's environmental health by actively addressing the potential for unique childhood vulnerability and exposure. Our goal is to reduce negative environmental health impacts on children through rulemaking, policy, enforcement, and research that focus on prenatal and childhood vulnerabilities. For example, EPA is confronting the harmful effects of criteria air pollutants on the health of children. We have decided to reconsider the 2008 national smog standards to ensure that they are scientifically sound and protective of human health. We will bring the best science to bear in our decisions. The Children's Environmental Health Centers, established in 1998 by EPA and the National Institute of Environmental Health Sciences, examine the interactions between key environmental exposures and a range of child health outcomes, such as growth and development, asthma, and autism, with the goals of preventing and reducing childhood diseases and translating the findings to the affected communities and the broader public. Assuring the safety of chemicals in our products and our environment is critical to ensure the health of children. EPA will establish standards, policies, and guidance to help eliminate harmful prenatal and childhood exposures to pesticides and other toxic chemicals. And last year, Administrator Jackson announced principles for modernizing the Toxic Substances Control Act, or TSCA. We are hopeful that TSCA will be updated by Congress so that we are better able to take action on chemicals that pose a concern, particularly those that affect children. Separately, we are shifting EPA's focus to address high concern chemicals and filling data gaps on widely produced chemicals. At the end of 2009, we released our first ever chemical action plans for 4 groups of substances, and more plans are in the pipeline for 2010. EPA also recognizes that children may be more vulnerable to pesticide exposure. We are planning to further strengthen assessment of pesticide health risks. By modifying our risk assessment approach, we hope to continue to minimize the adverse health consequences of pesticide exposure. We are also working closely with partners such as the Department of Housing and Urban Development and the Centers for Disease Control and Prevention, to protect children from pesticides in residences and in schools. We will coordinate national and international community-based programs to eliminate threats to children's health. EPA is collaborating with the Department of Health and Human Services, Department of Education, and a diverse group of stakeholders through our Children's Health Protection Advisory Committee to provide tools to communities to build a new generation of healthy green schools and help ensure that existing schools are in good condition and are properly maintained. EPA, HHS, and the Department of Housing and Urban Development are also collaborating to respond to the Surgeon General's call to action on healthy homes by taking advantage of opportunities to leverage federal resources to provide states, tribes, and local communities with the necessary tools to help improve home environments, particularly in underserved communities. EPA and HHS are also joining with other federal departments and agencies to work towards reestablishing the President's Task Force on Environmental Health Risks and Safety Risks to Children. And with this group, we will collaborate to address the most critical children's environmental health issues facing the nation. EPA is also working with other federal agencies to address environmental factors that contribute to the pervasive problem of obesity in children through our participation in the Task Force on Childhood Obesity. As part of our efforts in all of these areas, we will utilize our Children's Health Protection Advisory Committee to help ensure that we are developing effective strategies to address the most significant threats to children's environmental health. Thank you, Chairman Boxer and Chairman Klobuchar, and members of the committee for the opportunity to talk to you today. As evident by our strategy and actions, Administrator Jackson and I share your commitment to children's environmental health, and we appreciate your ongoing interest in our efforts. Thank you again for inviting me to give testimony, and I look forward to answering any questions you may have.
Thank you, Dr. Gravatt. Mr. Stevenson.
Thank you, Madam Chairman. I'm pleased to be here today to discuss EPA's and the federal government's progress over the last 10-plus years in addressing children's environmental health issues. My testimony summarizes our full report to the committee on these issues being released today. The scientific evidence about children's exposure to dangerous chemicals and the health effects of these chemicals continues to mount. For example, 66% of children live in counties that exceed allowable levels of at least one of the principal air pollutants that cause aggravated asthma, a significant problem for children, one that costs $3.2 billion in medical costs annually. EPA and the federal government took several bold steps in the late 1990s to make children's environmental health a priority. In 1996, EPA issued a national agenda to protect children's health from environmental threats. In April 1997, the President signed Executive Order 13045 that mandated a concerted federal effort to address children's environmental health and safety risk and established an interagency task force to recommend strategies to the President for protecting children. Also in 1997, EPA created the Office of Children's Health Protection and formed the Children's Health Protection Advisory Committee. However, this early momentum waned through the last decade. Our report, while acknowledging some successes such as the increased margins of safety for pesticides and the creation of the National Children's Study, concludes that EPA's past efforts to institutionalize children's health through its national agenda and strategic plan have not been sustained, that EPA has not effectively engaged its Office of Children's Health or proactively used its Children's Health Advisory Committee, and that the agency's interagency task force, which was largely responsible for the federal government's early momentum on child's health issues, was allowed to expire in 2005. We are encouraged that Administrator Jackson is attempting to refocus attention on children's environmental health issues and believe that the strategy just discussed by Dr. Gravatt is a step in the right direction. However, we believe that to ensure progress, EPA needs to implement changes in concrete and actionable ways to institutionalize its approach to children's environmental health issues. To this end, our report makes specific recommendations to EPA to include 1, updating and reissuing a national agenda to articulate current environmental health priorities and emerging issues, 2, identifying and tracking rulemakings and other actions to ensure that children's health issues are fully considered, 3, ensuring that each new strategic plan expressly articulates children-specific goals, objectives, and targets, 4, reevaluating the mission of the Office of Children's Health and ensuring that it has the resources and organizational placement to carry out its mission, and 5, more proactively using the Children's Health Protection Advisory Committee. We are pleased that EPA agreed with our recommendations, but believe they must be successfully implemented if EPA is to incorporate protection of children's health as an integral part of its everyday business. And finally, Madam Chairman, notwithstanding the actions that EPA can take on its own, leadership from outside the agency and across the government will also be needed to protect children from current and emerging environmental threats. The President's Task Force on Children's Environmental Health that expired in 2005 was comprised of 9 cabinet officials and 7 White House office directors, and was co-chaired by the Administrator of EPA and the Secretary of Health and Human Services. We believe that this task force provided the high-level infrastructure needed to coordinate federal research and strategies for addressing children's environmental health concerns through nationwide initiatives like the National Children's Study, a study that is examining the role of environmental factors on health and diseases in children from pre-birth to age 21. The task force documented this and other accomplishment in reports to the President, and in our view significantly enhanced the nation's ability to understand, analyze, and respond to environmental health risk to children. Nearly every children's health expert we talked to told us that the task force could help the federal government respond to national health and safety concerns such as recalls of toys and other children's products. Our report recommends that the task force be reestablished. We're pleased that you're introducing legislation to do so, and we see this as a critical step for the government to regain its momentum in comprehensively addressing children's health issues. That concludes a summary of my statement, and I, too, will be happy to answer questions.
Thank you very much, Mr. Stevenson. Thank you for acknowledging the legislation that we're introducing. What do you see as some of the advantages of going beyond EPA and coordinating with other agencies, as we want to do with this legislation?
Well, at least those 10 agencies that were on the task force certainly have roles in protecting children. The Consumer Product Safety Commission would be instrumental in things such as the toy recall. Mm-hmm. It could benefit from EP scientific assessments of chemicals that are typically used in toys. So it just created leadership across the government and provided great momentum for addressing this issue that has kind of waned since it expired in 2005.
I was thinking about that when we had the latest toy issue with the cadmium in the jewelry, and how when we had a previous hearing I asked about that and the studies that were going on at EPA, and just having that kind of coordination. It might not have been as much of a surprise as it appeared to be when suddenly there was this new problem that none of us had foreseen because we were so focused on the lead.
Yes, too, we think that the regular reports to the President on this subject help keep the public informed about what the government is doing to protect children as well.
Mm-hmm. I would just think that coordination might result in better legislation as you look at things, not just a specific thing that comes to one agency, but overall. How can we create accountability and ensure that the EPA is following through on its stated goal to make children a priority at the agency, since you guys are all about accountability?
Well, I mean, we think that, as Senator Lautenberg mentioned, the national agenda that sort of guides EPA's efforts in this area hasn't been updated for 10 years. And I think EPA is getting there, but it's not documented yet. We think that such a document with clear research priorities, chemical risk assessment priorities, and the like are critical to guide the agency. And we think that informs the public about what EPA is doing to protect children as well. And it sends a message across the program offices and regions at EPA as well as to this, to the fact that this is an important agenda of the administrator. We think that the regular reports that they provided to the administrator were also instrumental in keeping the momentum going. There's many things we think that need to be done in the rulemaking process. We recommended better tracking mechanisms to show how children's health issues are considered in rulemakings and standard setting and other actions that EPA takes. Mm-hmm. So there's a whole variety of things specified in our report that we think will go a long ways towards institutionalizing the addressing of children's health issues at the agency.
Thank you. Mr. Gravatt, what will the agency do to address the findings that are in the GAO report?
We've already taken steps to begin addressing a number of the findings, and I appreciate very much, as we indicate in our comments to your draft report, that the recommendations are sound. And so, for example, as I mentioned in my testimony, we're already working with other federal agencies towards the reestablishment of the Interagency Task Force on Children's Environmental Health and Safety, which we see as a critical step to helping the nation to be able to address these key issues. The agency has improved its tracking system for regulations to help to better capture children's health issues, and I've significantly increased the focus of the office on rules and regulations that are being developed by the agency. Through my interaction with the administrator and also with the senior career folks across the agency, I think we have an opportunity to increase the sort of reporting that you were talking about, the critical nature of that. I have requested and have received an increase in resources to my office this year in 2010 of 5 full-time equivalent employees and being increased in the office. And then the President's budget for 2011 includes a request for an additional 13 employees between my office and the regions to focus on healthy school environments.
Mm-hmm. And when you talk about healthy school environments, what do you mean by that?
I mean, to address the issues in schools that we think can both impact children's health in those schools as well as children's academic performance in those schools. So things like making sure that schools are dealing with moisture problems to prevent mold in the school environments, to help reduce the possibility of children experiencing asthma attacks in the school environment, making sure that when pesticides and cleaning products are used in schools, they're used safely so as to not inadvertently poison the children who are in those school environments, making sure there's adequate air exchange so that kids can be alert in their work and also protected from any kind of allergens other than mold that might cause asthma attacks within those school environments. So those kind of issues are all key to that work.
Okay. One specific question, and then I'll turn it over to my colleague, Senator Udall, who's arrived. Dr. Gravatt, in your testimony, you mentioned that EPA issued the lead renovation, repair, and painting rule, which aims to provide broad protections against inadvertent lead poisoning by requiring contractors and construction professionals to be trained, certified, and to use lead-safe work practices during renovation, repair, and painting in pre-1978 housing and child care centers. There is broad agreement that these increased protections for children are necessary, but there's also some recent concern among consumer health organizations and people who do this type of work that there are not yet enough certified contractors to meet EPA's requirement when this rule could take effect. I understand that EPA has less than 200 accredited trainers and less than 14,000 certified renovators nationwide. We're not quite at the 200,000 we need to make this work. And I did write a letter today to Administrator Jackson expressing concerns about how implementing this rule next month, that we simply might not be ready yet, and it could not have that desired effect that we want to reduce the lead, and at the same time, because of the lack of the contractors, the trained contractors, could hinder the home energy efficiency upgrades. Do you know what EPA's position is on this? That was a long question.
It was a long question, but a very important one. And excuse me, I'm sorry. It is a tremendously important rule implementation. Effective implementation of that rule is tremendously important to protect children's health in home environments and other environments where they spend time. And the administrator is well aware of this issue, and I was speaking with the deputy administrator about it yesterday, looking towards increasing opportunities and awareness of the contractors of the need to be trained for implementation of the rule. And I think there are a number of factors at play here. We think that we have enough trainers now to reach out to a large group of contractors across the country. We think there is still an issue with increasing the awareness among the contracting community. It requires them to spend roughly a day in a training course with 2 hours of hands-on training, and we are not getting the response from the contractor community that we need as yet. So we're talking about specific ways of outreach in the near term, very near term, to try and increase participation in the training and get those numbers up where they need to be.
Yeah, and I would suggest, just because we're working so hard with our stimulus and jobs package, that perhaps some delay will be necessary with the immediate outreach and a different date, because I'm just concerned about these numbers are so far out. But that's something that I know you'll be discussing at the EPA.
That's right. Thank you.
Okay, thank you. Senator Udall. Yeah, I see you're wearing green. I forgot to.
Thank you, Madam Chair. I am wearing green. Somehow I managed to remember this.
You're very organized. Yes.
It's a bit.
You must be part of a coordinated green interagency task force.
No, I happened to see Senator Leahy last night in black tie on the floor, and I said, what's going on there? And they said, he's going to the dinner.
Oh, and then that
St.
made
Patrick's.
you
And so
remember.
then it reminded
Okay, good.
me. So,
Sort of an
anyway.
interagency theme. Okay, there you go.
Anyway, Madam Chair, thank you very much, and thank you for focusing on this issue. I know you have a real passion for children's issues and children's health, and look forward to really working with you on this committee to achieve some good goals. This question is for both Mr. Stevenson and Mr. Gravatt. The EPA's national agenda to protect children's health from environmental threats came out in 1996. That same year, Congress reauthorized the Safe Water Drinking Act with a focus on cost-benefit analysis. Since 1996, the EPA has issued few new drinking water standards. Under the previous administration, EPA decided not to regulate perchlorate, an ingredient for explosive that harms the thyroids of pregnant women. What are the challenges with incorporating the special health effects of children in the Safe Water Drinking Act? Either one of you jump in there.
I'll defer to Dr. Gravatt on that.
Okay, thank you very much. A very important issue, perchlorate in particular, but more broadly addressing contaminants in drinking water. And we are, I think you're aware that within the last year, EPA reevaluated the health risks related to perchlorate and issued an updated risk assessment for perchlorate for public review. And at this point, the administrator is considering what decision to take specifically with regard to possibly regulating perchlorate as a contaminant in drinking water. But more broadly, the Safe Drinking Water Act, in addition to requiring a cost-benefit analysis, does require a consideration of vulnerable populations for drinking water contaminants, including children. And we will be working very closely with the Drinking Water Office as well as other offices across the agency in their own regulatory actions to make sure that children's health vulnerabilities are considered through any rulemaking activities that will address drinking water contaminants.
The only thing I would add is that we do have some ongoing work on perchlorate right now as an emerging contaminant in drinking water, and that I believe this committee is one of the requesters for that report, which will be out later this year. It doesn't single out children's health issues, but it will talk about the problems that EPA has and the length of time it takes to do chemical risk assessments in general. Perchlorate, for example, has been studied for over a decade now, and we may have some specific recommendations on the issue of chemical risk assessment coming out of that report.
Thank you. Mr. Stevenson, you recently testified at our committee regarding efforts to reform the Toxic Substances Control Act, which is clearly out of date at best and possibly fatally flawed. The question for both of you is, which of the proposed reforms to this law have the most potential to provide an extra buffer zone of protection for children? Biomonitoring, risk screening of chemicals, increased data for producers, or increased authority to restrict chemicals, or does this require a comprehensive approach?
All of the above, a comprehensive approach. The biomonitoring data will tell you what chemical exists in the blood, but it doesn't tell you the causes or the likely health effects of that data. But it's an important element to help prioritize which risk assessments are needed. So we haven't looked at all the various proposals to amend TSCA. We have been studying the issue for 5 or 6 years and are definitely in support of amending TSCA and giving it more teeth and strength for the agency and requiring more of the chemical industry in the way of proving that its chemicals are safe before they're introduced into commerce.
And thank you. If I may, I agree with Mr. Stevenson's comments on that. I think any one of the factors that you mentioned there would help, but without the full suite of those, I think it would be very difficult for us to move forward in the way that we need to on TSCA implementation. And the Administrator Jackson, issued recently her key themes that she thought were important in TSCA reform, and we're very supportive of moving forward in this area.
Thank you. And there's a continuing push by business and industrial interest to include more and more cost-benefit analysis and environmental regulation. How is that effort compatible with children's environmental health, which may not be as easily quantified?
I'm sorry, I'm not sure if that's a question for me or for both of you.
Jump in if you both want. I'm running out of time.
All right, thank you very much. So
please,
I think that it is important for us to focus on cost-benefit analysis related to children's environmental health, but the emphasis I would put there is doing a better job of understanding the costs associated with childhood impacts and the benefits associated with taking actions to prevent those impacts. So in particular, I think there's more work that we could be doing there to better capture the benefits of steps that we take to protect kids from environmental contaminants.
I think this is a place where you can use the Children's Health Advisory Committee as well. It's just there are several new members. Half of the committee is going to be new. They're just convening the new committee soon. But EPA asking them and using their expertise, they have industry representation, academic representation, special interest, and everything else, and that's why they're there. So I think they can help EPA better determine how to consider children's health issues in that manner.
I thank both of the witnesses and the chair, and thank you for your courtesy to let me run over a little bit. Sorry I can't stay for the whole hearing. I think this is a very, very important subject.
Thank you very much, Senator Udall. One last question, Dr. Gravatt. As you know, there's finally some movement afoot to do something on childhood obesity. It's been dormant, and as our recesses have gotten shorter and our attention, I think, has gotten shorter, our kids' waistlines have gotten larger. And we just haven't been devoting the attention we need to it. As you know, a third of kids that now graduate from high school are obese, overweight, and a fourth are obese going into elementary school. And the Child Nutrition Act, as I mentioned, is being introduced today. That's one thing. And as we go into some of the education work that will be done this summer, I think we should be looking at recess and gym time as a piece of that. We have our Complete Streets bill here where we're trying to move on community planning and things so that it's more is done to incentivize and encourage walking. But I just wondered what EPA is doing as part of this effort. I just see it as a huge money for taxpayers. We're financing for very good reasons and necessary reasons, not just school lunches and breakfasts, but also pre-K, the child care program. 3 million of these kids are getting food every day. And one of the most amazing things to me, I introduced a bill on this week with Senator Harkin. It's now being included in the Child Nutrition Standard. I just want to make sure you know this. There are really just not standards at all for these child care meals, and yet we're paying for it. The taxpayers are. The 1 out of 3 kids, a recent study showed that kids in these child care programs do not even have a fruit or a vegetable all day, and that the most common vegetable is French fries. And you think about what we're giving these kids, it's just not right. And so this is something that I really believe has to be changed. I've seen it in my daughter's own schools, the difference between being in a sort of a different demographic with parents with more money. These kids are bringing carrots and celery in their lunches, and then at the other school she was in for 3 years with 90% free and reduced lunch, these kids are, choosing the Twinkie line and the French fries instead of the yogurt in these a la carte lines. And it seems to me the kids we're hurting most are the kids who are the most vulnerable and who need the most help during the school day, and it has to change. So I just wondered what EPA is, what you're doing in this regard as part of this big focus of the First Ladies, which I truly appreciate.
Senator, thank you very much, and I appreciate your leadership on this critical issue. And childhood obesity certainly has the potential to lead to the current generation of children being the first generation in American history who may have a shorter life expectancy than their parents. So this is a critical issue for us to address. As a part of the Interagency Task Force on Childhood Obesity, EPA is an active participant. All the key players are there focusing on physical activity, focusing on the built environment, focusing on food availability and food nutrition guidelines, school lunches, and a variety of other issues that intersect with obesity in some ways that may not be obvious, including the intersections between childhood asthma and childhood obesity, the intersection between some chemical factors that may lead to infant obesity. And so EPA is an active player in this area, and I think you're aware that the President's memorandum on childhood obesity that established the task force gave us a 90-day time frame to produce a report, a comprehensive report from across the federal government on key steps that will be taken to address childhood obesity and eliminate childhood obesity within a generation. EPA is an active participant in that effort, and we will remain so.
Okay, very good. Well, thank you very much. This has been informative. I especially like the question part. I mean, the testimony wasn't bad, but, you know. I think we got some very useful information on the focus here, and I thank both of you. And now we'll bring up the second panel. Thank you. Okay, very good. I'm pleased to have the second panel here. Our first witness will be Gina Solomon, doctor who is the Associate Director of the University of California in San Francisco Pediatric Environmental Health Specialty Unit and the Center for Occupational and Environmental Health at the University of California at Berkeley. Secondly, Cynthia Barer, also a doctor who is the chief of the Division of Neonatology at the University of Maryland School of Medicine. And then finally, Dr. Ted Shetler, who is the science director for the Science and Environmental Health Network. Thank you all for being here. Dr. Solomon.
Good morning, Madam Chair and members of the committee.
They come and go.
Thank you.
And we've actually had very good attendance. I'm excited.
And I think that it's a great testament to this topic, and I'm very glad to be here to testify today. I'm a physician. I'm also a senior scientist at the Natural Resources Defense Council and an associate clinical professor of medicine at UCSF, and I do work with the UCSF Pediatric Environmental Health Specialty Unit. And one of the most frequent questions that I hear from my patients is, what can I do to protect myself and my family from chemical contaminants in our air, water, and food? And I always find it difficult to answer that question because most hazards to children and families are not things that individuals can really protect themselves from, even with advice from their physician. Really, it's the responsibility of government agencies such as the EPA to ensure that our air and our water are safe for pregnant women and children. And decades of scientific evidence have accumulated demonstrating that children are more susceptible to contaminants in their environment. And in the 1990s, the President and EPA recognized that evidence and took important actions, including Executive Order 13045, which we've heard about, the National Agenda to Protect Children's Health, and the creation of the Office of Children's Health Protection. And Congress recognized the overwhelming evidence on children's susceptibility when it passed child protective language in the Food Quality Protection Act. And for the first time, EPA was actually required to incorporate an additional 10-fold margin of safety to protect children from pesticide residues on food, and in particular was required to do that if there were data gaps. And so this approach would seem to be a model for how to protect children, but in the last 14 years since then, a couple of problems have become apparent. One of those is that the law applied only to pesticides, and to this day there are no legal requirements that EPA actually protect children's health from other industrial chemicals, including chemicals that are known to disproportionately affect fetuses and children, such as bisphenol A, phthalates, brominated flame retardants, and even arsenic. And the second problem is that EPA failed to honor even the directive of the Food Quality Protection Act. I was on an NAS committee which reported in 2006 on EPA pesticide assessments. They looked at 59 pesticides with assessments posted on EPA's website, and EPA failed to apply the child protective factor for 48 of the 59 and only applied the full 10-fold factor to 5 chemicals, despite the absence of widespread data gaps on many of these chemicals. And in more recent years, there have been problems at EPA with their approach to protecting children from carcinogens. And that's diametrically different to the situation in California, where California considers children to be more sensitive to all carcinogens unless shown otherwise. Instead, EPA currently limits child protective considerations to chemicals with a mutagenic mode of action, and in their framework document sets such a high standard of proof for a mutagenic mode of action that it's basically unachievable for most carcinogens, and the net result is the child protective factor is not likely to apply to the vast majority of cancer-causing substances. And I'm encouraged to hear that EPA may revisit this policy because it clearly needs to be changed. The biggest threat to children's health, however, in my opinion, may not be from the chemicals we already know about, the carcinogens we already know about, but from what we don't know, because we're dealing with the unfortunate reality that most of the chemicals in our air and our water and even our children's toys, as you well know, have not really been tested or have not been tested at all for their toxicity. And so I'm not just talking here about testing for effects on infant development, but in fact for effects on all kinds of health effects, genetic damage, neurologic damage, hormonal effects, allergic reactions. Basic safety assessments of all chemicals, not just pesticides, are needed in order to protect children. Only with broader chemical policy reform will parents be able to sleep soundly at night, knowing that their children are safe. Thank you very much.
Thank you, Dr. Solomon. Dr. Baird.
Thank you, Senator Klobuchar. Sorry. I am a practicing neonatologist, which means I take care of the sickest of the babies, newborn babies. I'm also a wife and a mother, and my son Matthew is in the audience today.
Welcome, Matthew. Where are you? Oh, I can tell you want me to call you out. You look, I didn't have you stand. Okay.
I am currently professor and division chief of neonatology at the University of Maryland. And I'm here today, though, as the chair of the board of the Children's Environmental Health Network. The network commends Senators Boxer and Inhofe for holding this hearing, and for you for running it today, and for their ongoing interest in environmental risk to children. I ask that my full statement be submitted for the record. The network's mission is to promote a healthy environment and to protect the fetus and child from environmental health hazards. I urge the committee to embrace its role in ensuring that all children grow up in healthy environments. I will discuss three overarching tenets. My first tenet is that the basic scientific facts of pediatric environmental health need to be incorporated into the policies and programs in this committee's jurisdiction. Children, as we heard this morning, are not just little adults. They have unique vulnerabilities and susceptibilities. Because their systems are developing, an exposure that causes little or no damage to adults may lead to irreversible damage to children and the adults they become. Children are exposed every day to a mix of chemicals, most of them untested for their effects on developing systems, as Dr. Solomon just noted. Policymakers could and must do a better job of assessing the role that environmental toxicants have on affecting the current and future health of developing human beings. The predominant and worrisome assumption is that potential hazards are innocent until proven guilty. One example is bisphenol A, or BPA, which is widely used in consumer products. Only recently have scientific studies shown that BPA causes harm. These studies have come long after massive population exposure has already occurred, with more than 90% of our citizens having BPA in their bodies. As a result of these reports, BPA is being phased out of products used in the neonatal intensive care unit at the University of Maryland Hospital for Children. BPA is just one chemical that is ubiquitous in our environment and in our bodies. Parents understandably ask, how did we allow these substances to get into our children's bodies when we know so little about them? I don't know how to answer them. Most industrial chemicals are regulated through the Toxic Substance Control Act, or TSCA, which was enacted in 1976. However, EPA comprehensively regulates very few chemicals under TSCA. We need to protect the health of children through our chemical regulatory decisions. My second tenet is that children's health and healthy children must be an ongoing priority for this and every administration. A series of forward-looking policies were adopted in the 1990s. Over time, their original successes have stalled. Previously, leadership of an interagency task force by the EPA administrator and the Secretary of DHHS galvanized efforts across the government. We need such a catalyst again in order to regain momentum. The network believes that key components of the 1997 Executive Order on Children's Environmental Health, such as the interagency task force that it created, should be put into statute. Such legislation must also assure that other key agencies handling child care and related issues, most notably the Department of Education, are actively engaged. I want to highlight the importance of the EPA's Office of Children's Health Protection in this process. The network feels that it must have a robust presence within EPA in steering policy and science initiatives for the good of protecting children. Their advisory committee, the SHPAC, plays a critical role in providing advice and feedback to the EPA. My third tenet is that protection of children's environmental health must occur indoors. One focus on interior environments such as homes, child care centers, and schools is necessary. For example, little is known about the environmental health status of our child care centers, where 60% of children from 1 month to 5 years of age spend more than 40 hours per week. Most people do not know that there is no agency authorized to intervene to protect children from environmental hazards in daycares, preschools, or schools. The Occupational Safety and Health Administration does not protect preschool or school children. Thus, every day we require our children to spend hours in environments that are not required to be healthy and where they and their parents have no options, alternatives, or recourse. The network also commends the EPA for its existing Healthy Schools activities. We are especially supportive of the proposed Clean, Green, and Healthy Schools initiative. If we work to ensure that the many environments that make up our children's world are healthy and promote well-being, we will improve the health of our children and the adults they will become. Thank you for the opportunity to testify. I would be happy to answer any questions.
Thank you very much, Dr. Baird. Dr. Shetler.
Thank you very much, Madam Chair, and thank you for the opportunity to testify here today. I'm Ted Shetler, and I am the Science Director of the Science Environmental Health Network. I'm a physician, and I also have training in public health and environmental medicine. We've heard from a number of people today that developing children are uniquely vulnerable to environmental exposures. I'd like to add to that early life exposures can also increase the risk of chronic degenerative diseases in adulthood, so that while we are protecting our children, we are also lowering the risk of disease later in life. We've also heard that during the 1990s it appeared that EPA was taking steps to address many of the unique aspects of children's environmental health, but since then some of these efforts have fallen short. I'd like to just add two examples from my own experience to illustrate this. The first has to do with the potential for some commonly encountered chemicals to disrupt the function of hormones and other chemical messengers that are important during child development. These chemicals are called endocrine disruptors. During the 1980s and 90s, it became apparent that reproduction and development of many species of wildlife were being affected by exposure to these chemicals, and laboratory findings confirmed these outcomes. Many scientists then began to wonder whether increasing incidence of cancer of the testis, prostate, breast, birth defects of the male reproductive tract, lower sperm counts, behavioral disorders, and other abnormalities in humans might be explained in part by similar exposures. And so in 1996, the EPA created the Endocrine Disruptor Screening and Testing Advisory Committee in response to a congressional mandate, and the EPA was directed to develop a screening program to determine whether certain substances may have endocrine disrupting effects. This was supposed to be implemented by 1999. I served on that advisory committee, and we delivered consensus recommendations by the statutory deadline in 1998. Unfortunately, thereafter, EPA missed deadline after deadline and became bogged down in an endless set of validation exercises that remain unfinished today. Meanwhile, thousands of chemicals in consumer products, food, water, and air have not been tested for endocrine disrupting properties. Recently, the Endocrine Society, the American Medical Association, and the American Chemical Society have called for reducing exposure to endocrine disruptors as well as more rapid advancement of the screening program. Sadly, the EPA is a decade late, and we are still waiting. My concerns about human exposures to commonly encountered chemicals are not limited, however, to endocrine disruptors. As we've also heard, flaws in the Toxic Substances Control Act have allowed thousands of untested chemicals to remain in commerce with limited or no toxicity information. A second example is the failure of EPA to require adequate evaluation of the impact of pesticides and other chemicals on brain development. The agency has the authority to require those data from pesticide registrants, but historically has been reluctant. In the 1990s, EPA finally asked for developmental neurotoxicity testing of a group of pesticides called organophosphates, which are notoriously toxic to the brain. But if we thought that we were finally going to see more regular requirements for this information, we were sadly disappointed in 2007 when EPA registered the fumigant methyl iodide for use without it. This chemical is an extremely toxic chemical. It causes severe nervous system toxicity in adults who are accidentally exposed. Unfortunately, effects on the developing brain have never been studied. In my written testimony, I've described why I and others believe we must be concerned. EPA's rationale for not requiring the data on this pesticide is based on an untested hypothesis for which there is little evidence. The Department of Pesticide Regulation in California carried out its own risk assessment of methyl iodide and sent it out for external review by a scientific review committee. In its final report, that committee not only expressed concern about the likelihood of human exposures when this chemical is used in agriculture, but also said, and I'm quoting, "An equally important element in our review was the data that we would have wished to assess, but that was insufficient or non-existent altogether. The lacunae in our knowledge about methyl iodide are particularly wide and deep in relation to key aspects of its potential toxicity, such as neurodevelopmental effects." That's the end of the quote. Wide and deep data gaps with respect to this chemical's effect on the developing brain, yet the EPA registered it for use. So in conclusion, some efforts to protect children's health that were taking hold seem to have slowed and even been abandoned. Developing children continue to be exposed to environmental chemicals without adequate safety assessment, many of these under the authority of the EPA. Meaningful TSCA reform and EPA's exercise of its existing authority are essential in order to protect developing children and really people of all ages from the impacts of exposure to hazardous chemicals. Thank you, Madam Chair.
Well, thank you very much, and thank you for sort of bringing this down to the real world level and the kids that you deal with in your work. I was listening to this thinking of, I hadn't really related this, but of my own experience when my daughter was born. She couldn't swallow for a year and a half, and no one could figure out what was wrong. We still don't know what was wrong, and she somehow snapped out of it after being on a feeding tube, and I spent many weeks in the neonatology unit and things like that. And when I look back at that time now, is because she's an amazing kid and she has no permanent thing. There was nothing genetic. I always think of that time as a gift. One, it gave me some sense of what parents with kids with disabilities go through. But two, it made me always wonder, was I exposed to something when I was pregnant? What happened? How did this happen? And how did she suddenly snap out of it when it wasn't a permanent problem? And I know a lot of parents dealing with kids with autism and other things that just daily wonder the same thing as we see these sudden increases in certain diseases and don't know what they are. And that's one of the things that drives so many families to want to see that research and just feeling so alone out there, surfing the internet, coming up with theories that make no sense because they read them on a blog, when we should be looking at these scientifically and we should be getting the data collected. So I guess I want to tell you how I know that I and so many families share that frustration that we're not getting the data, Dr. Shetler, that you're talking about. So my question, first of all, is how do you think, in the ideal world, this interagency task force could work to try to better share things? And what do you think, as we look at, difficult budget times for government, what do you think the most cost-effective way, and where should our focus really be as we look at all the myriad of potential problems we have here? I know those are two big questions. The first would be how the interagency task force could better coordinate it, and I guess the second would be how we could do this most cost-efficiently and what our focus should be. I guess, Dr. Bayer, I'll just begin with you because I mentioned you. You can all three answer it.
Thank you. I see the interagency task force as being able to link across agencies various pockets of pediatric environmental health. For example, the biomonitoring programs at CDC to be linked to EPA's list of priorities for chemicals that need to be studied, to the NIH where research dollars need to be spent in order to assess the toxicity of the chemicals. Finally, I also see it as a clearinghouse for research and initiatives of what's actually going on right now. There's no place where you can go to find out what research is actually being done. And I see the interagency task force as being important in collecting and organizing and making publicly available what research is actually happening.
Okay, thank you. Dr. Solomon?
In addition to coordinating with agencies such as CDC, with chemicals that are in food contact materials and in consumer products, such as known endocrine disruptors like bisphenol A and phthalates, we're finding that FDA and CPSC have very major regulatory roles and yet often don't have the same sort of toxicologic approach or expertise in those chemical areas as EPA, and it's really important also to have consistency. We saw this as a problem when EPA and FDA were sort of publicly disagreeing a number of years ago about levels of mercury that are safe for women of reproductive age, and very recently FDA, EPA, and NIEHS sort of came together around bisphenol A, and they're trying to come to a common ground. So it's very, very important to avoid sort of conflicting standards or sort of conflicting messages to the public as well. But I also think in terms of priorities, all three of us mentioned chemical policy reform. It really is a huge, huge issue.
You're talking about TSCA.
TSCA is the main issue area where we're dealing with both enormous data gaps that impair all of us as physicians from being able to provide information to patients and communities, and also this problem that EPA does not have the authority it needs to take regulatory action, even when there is evidence showing harm to developing organisms in children. So,
well, and you think about all the new products and changes in our society and the fact that it hasn't been updated for so long. It actually clearly cries out for some changes. So.
Exactly. The science has moved forward. There's a lot of information from the National Academy of Sciences to go with, and that really is something that needs action soon.
Okay. Dr. Shetler.
I would agree with the need for coordination across the agencies, and don't have more to add to that. It's very important that we not sort of balkanize this and fail to look at it comprehensively. With respect to the second question, the issue of cost effectiveness, I would agree, first of all, with the importance of TSCA reform, and some of the elements of that have to include that chemical manufacturers need to be responsible for evaluating the safety of their products. I mean, this should not fall on the public to do that after the fact. So it should be, pre-market testing is required. You're going to stay on the market. We need safety data. But I also would like to add a little more to this idea of cost and benefits, which came up in the first panel. We know that a lot of the childhood conditions that we're concerned about today are setting the stage for an overwhelming wave of disease and disability that is coming down, that is going to overwhelm us in the next several decades. As was pointed out in the first panel, child obesity itself is a risk factor for diabetes, cardiovascular disease, cognitive decline, dementia, and Alzheimer's disease. And I'm not certain what we're going to do about this. And at a time we're talking about health care reform in this country, we should be really looking at what's coming as we try to figure out primary preventive strategies to try to prevent this flood of chronic disease that's coming along. So when we're doing our cost-benefit analyses, let's look at the whole picture, and let's look at it over time, and see how we're going to be dealing with that decades from now, as well as in the shorter term. Thank you.
Very good, thank you. And I just want to ask a few specific questions with some work that I'm doing, legislation that we're working on. I mentioned formaldehyde, and there's a huge problem of some of these wood products coming over primarily from overseas because our own timber industry has agreed to some standards voluntarily, but yet we're seeing, and this is the whole the trailer issue down in Katrina and those things, formaldehyde in these wood, and that's why Senator Crapo and I have a bill that basically follows the California standards, Dr. Solomon, and I can tell you it was quite interesting to stand with our timber industry in Minnesota at a Home Depot where we were supporting this bill to take up the California standards nationally and have the industry people talking about how they wanted the California standards, which you can bring that home for you. But because of the fact that these wood products are coming in with formaldehyde and they're unfairly competing with our own American timber that is actually in wood products that's actually abiding by these higher standards. And just I wondered if any of you, and I don't expect all of you, could comment on the formaldehyde issue with kids.
I'm happy to comment because I've been in numerous of those FEMA trailers. I spent a lot of time in New Orleans after Katrina. I talked with families who lived in FEMA trailers for months or even years and heard firsthand from them about the symptoms that they were suffering from, ranging from increased rates of asthma to just constant nagging irritation of the upper airways and constant headaches. And, this would have been so preventable, so avoidable. And I think that there's a broad concern about voluntary agreements that is raised by this issue because a voluntary agreement is good as long as everyone abides by it. But in this age of global commerce, it's very hard to get the entire industry, especially internationally, on board. We're seeing that more recently with the flame retardants, where there's been voluntary agreements with U.S. manufacturers of these polybrominated diphenyl ether flame retardants, PBDEs, to take them off the market. But I'm personally very concerned that we're going to still be seeing them in imports from other countries. And so this is why Congress needs to take action and why EPA also needs to take regulatory action and not count on voluntary agreements to protect the public.
Right. Cadmium in jewelry, speaking of imports, anyone had any familiarity with that and the effect on kids? Mm-hmm. Okay, that's all right. I think I've asked the EPA about this in the past, so I appreciate that. Other things that we've been working on, radon and the effect of children on that. We're putting together a bill in that area. And then, as you know, Senator Boxer and Senator Boxer has been a leader on perchlorate monitoring and the Right to Know Act and has done a lot in that area. So there's a lot of specific things we're working on, but I can't help but think that cry out for action, that having this interagency task force where we're drawing these resources together, as you say, for research will really help us in Congress so that when we move ahead in one area, we're not just doing one little thing. Maybe we should be doing three things at the same time. And I think it'll be very helpful if we can get that task force going. Anyone else would like to add today?
I'd like to add one more comment. Thank you for the opportunity. As I listen to the discussion about perchlorate and about formaldehyde and air pollution, I think it's important for us to keep in mind that we aren't exposed to these various contaminants one at a time, but we're exposed to mixtures, and it occurs in a social and an economic environment which may cause either more or less vulnerability. This is all fairly well outlined in the National Academy of Sciences report on science and decisions. But these are very real issues. So people who are not just exposed to perchlorate, but in farming communities, for example, there's going to be nitrate in their water at the same time. They may be women who have inadequate iodine intake in their diet. 30% of women in the United States are estimated to have suboptimal intakes of dietary iodine, making them more susceptible to the effects of perchlorate and nitrate in terms of being able to produce enough thyroid hormone for their baby to develop in utero. So we need to think about these things collectively. Similarly, children who are exposed to formaldehyde and air pollution who also happen to be living in suboptimal socioeconomic environments are more likely to develop asthma as a result of those exposures because the social environment creates vulnerability. So these do need to be looked at through sort of this interagency, comprehensive approach that will recognize that there are vulnerable populations of people among the general population who do need to be protected. Thank you.
All right. Thank you. Dr. Solomon? We usually don't do this at the end, but, you're up here, and it's just me. Just add your final comments here.
Thank you for the opportunity for a final comment. I've served on a number of EPA advisory committees over the years, including the Drinking Water Committee, and have been frustrated at how long it takes from the time when there is enough scientific information to take action to when action actually occurs. And perchlorate's an excellent example of a chemical that has been under study for well over a decade and where there's extremely strong information about exactly what it does in the human body and enough even data in humans on which to take action, and yet this chemical has not been regulated yet. I've seen the same thing with numerous industrial chemicals. It was over a decade ago that the Science Advisory Board reviewed the trichloroethylene risk assessment and recommended that it be finalized as soon as possible, but a decade has passed and it's now undergoing another round of review. And that's the type of pattern that tends to occur. And one of the things that will be important with TSCA reform will be to get out of that endless loop of repetitive and interminable risk assessments. We certainly also saw it with dioxin, another ongoing example. And so EPA really does need not only the authority, but in fact the responsibility to take rapid action when there's information, scientific evidence showing harm to children's health.
Okay, thank you. Okay.
I'd really like to say that I think the National Children's Study should go forward to generate some of this data, because not only, as Dr. Shetler noted, that we're exposed to mixtures, but we're exposed over time. And with children, that can be important for setting them up to future vulnerability following a previous chemical exposure. And so until we understand this complex play of determinants on our health, but occurring over time in our children, I don't think that we'll have a good idea of what's actually impacting our health.
Okay. Well, thank you, all of you. This has been very enlightening, and I think you've seen a number of senators that came by today are similarly devoted to moving forward on this. I know the EPA is, and I appreciate the GAO work as well in looking at this and stepping back and looking at how we can do better. I wanted to note that Senator Boxer, I think she talked to me about this hearing 5 times in the last 24 hours. She really had wanted to be here, cares a lot about this, has been a true leader on this issue. She even caught me in the hallway and said, "You're going to be 5 minutes late." And she would be here, but as you know, there is a lot going on right now in the United States Senate, and so she was needed elsewhere to work on some very time-sensitive issues. I know she wanted to be specifically here to greet you, Dr. Solomon, but I'm going to put her statement on the record, and also the GAO report on environmental threats to children, as well as the EPA's 1996 National Agenda on Children's Health, So without objection, those things will be included in the record, and we look forward to working with all of you on this important issue as we go ahead. Thank you very much, and the hearing will be adjourned.